Are we ready? Okay. All right. We'll convene the meeting of the Dubuque County Board of Supervisors, joint meeting with the Dubuque County Board of Health, Wednesday, May 6, 2020, 10 a.m. And I would like to wish a happy Nurses Day to all of our nurses and also to all of our wonderful providers, healthcare providers, and first responders. All right, on the agenda, first item, update from the County Emergency Response Team on COVID-19. We're going to go right away to law enforcement update. Okay.
This is Ed Raber. That's okay, Supervisor Baker, I take that. Last Monday at our board meeting, there was a discussion among the supervisors about what's going on with enforcement and around the county. And as I conferred with Sheriff Joe Kennedy, we thought that it might be nice to get some updates from law enforcement personnel, chiefs, et cetera, from around Dubuque County. So we, Sheriff Kennedy and I invited all of those folks, and many of them are here. So I'm going to turn this over to Sheriff Kennedy to sort of moderate this little session.
Okay, thanks.
I might for a minute. This is Supervisor Ann McDonough. Something I think we've overlooked is for this board to express our appreciation for these individuals. They are the front line as well. And, they are doing their work every day without any hazard pay per se. And, there's been no discussion about that, but they truly are working to cover all shifts, dealing with probably situations that they had never anticipated when they began this career. So I just want to express my appreciation, certainly. And if there are issues we should be addressing, I am hopeful that you will bring those types of issues to the Board of Supervisors.
Thank you, Supervisor McDonough, and I concur. And when I mentioned first responders, of course, I have our law enforcement and our firefighters in mind, as well as our EMS. So, thank you. All right, Ed, back to you.
Thank you for those comments, Supervisor McDonough. I totally concur. Sheriff Kennedy, you're here on the call, correct?
That's correct.
So this is a bit unscripted, but we just wanted to provide an opportunity for all of these law enforcement leaders to perhaps give the board a sense of how things are going in their community, how they're approaching the enforcement or related to the governor's proclamations, especially as some of our neighboring counties are under sort of a different set of guidelines at this particular time, and any challenges that they see, or as well as the positives, and how they and their staff are doing. So I'd like to turn it over to Sheriff Kennedy to sort of begin this discussion, which hopefully will be about 30 minutes.
Well, first of all, I'd like to thank everyone, the board members and Ed for the recognition. I know that the medical field is the one that's taken the brunt of the whole COVID thing, but we're hearing daily about law enforcement officers who are succumbing to the illness. So it's concerning for most of us in administration within law enforcement to have to potentially be facing that with our own people. So we certainly appreciate the recognition. As far as the enforcement efforts, as Ed spoke about, he and I had discussed this, and we thought it'd be appropriate to hear from as many of the cities in the county as possible from their law enforcement executives. Being a county, the sheriff's office, most of our patrol area. There in the unincorporated areas, there are very few businesses out there that would draw anyone's attention if there was a complaint. And each of these individual cities probably has come into contact or have received calls that maybe we weren't necessarily aware of people violating social distancing requirements or violating the governor's emergency declaration. So we thought it was important to see what they were experiencing in their areas. I guess since I'm speaking right now from the sheriff's office perspective, we had the very first day of the emergency declaration on St. Patrick's Day. We had two businesses that we had to go speak to. They were having large St. Patrick's Day gatherings, but the business owners were very cooperative. And I know that I believe the emergency declaration started at noon that day. And these calls came in a few hours later, and both business owners had stated that they were unaware of that declaration, which, we understand that, it was one of those things. You're never going to catch 100% of the people. So, but they were both very cooperative when we advised them of the declaration, and they both shut down operations. Other than that, I know we've assisted, I think Asbury on a couple things, but for the most part, we have not had really any calls for any violations of any of the social distancing requirements. So, I guess I would like to hear from the other chiefs and see what their experience has been, and I guess I'll let them pipe in as they see fit.
Okay. For the other law enforcement professionals, chiefs that are on the call, you can unmute yourself.
Brent Schroeder, Dyersville Police Department. I'd like to echo what Sheriff Kennedy had to say. We haven't seen very much of an issue here in Dyersville, and with the restrictions being lifted in the neighboring county, which actually runs through our city, the vast majority of businesses are on the Dubuque County side, so they're not going to be affected. And we've been focusing primarily more on education than strict enforcement.
Thanks, Brent.
So I might just go through and start unmuting people as I go through here. Chief Dulsing.
Morning, everybody. Not going to be too much different than what the sheriff or Chief Schrader said. I would say, if not daily, several times a week, we're getting some type of complaint about social distancing or people gathering or something of that nature. Generally speaking, our officers are educating people, making sure they're aware of it, and usually a warning takes care of it. We have had several situations where we have charged people with violation of the governor's proclamation. I would say, lack of better terms, we've had some parties that we have gotten a little too large that they've warranted a police response, so that's resulted in charging the host. Besides the alcohol violations or any other situations like that, we also have charged people with a proclamation. Some large disturbances, we charge people with a violation of the governor's proclamation. So generally speaking, the business community has been very good. The community in general has been very good. We get little ups and downs here and there, and we know that individuals that have been self-isolating or otherwise limiting their community activities might be getting a little twitchy sitting in their house all the time. So we get a little bit of jealousy going on. If I can't do it, why should they? As people are looking out into their neighborhoods and seeing things going on. But again, for the most part, the community has been very cooperative. Assistant Chief Jeremy Jensen is also on this call. I will turn it over to him because he's overseeing kind of the day-to-day operations with the COVID-19 relief response. So I'll see if he has any additional to add at this point.
Thank you, Chief Dalsing.
Yeah, I don't have a whole lot to add to that, other than we are, cognizant of it day in and day out. We do, early on, we were doing daily, twice-a-day briefs with our patrol officers just as we're trying to sort through all of this, and now we're down to twice a week. But we are staying on top of that. We've had, some, particularly one health or fitness place that pushed us on it, and when we got past the education and got serious with them, they've decided to play along with it. So all in all, though, the businesses have been great. We are going out educating. The officers are out, and if they notice something they don't think is right, they'll stop and talk, particularly with the businesses if they're not sure how they fall into this and working with them. But it is back to education. We really want people to voluntarily do this and without us stepping in and finding people that, and particularly around people that may have already lost their jobs and things like that. So we're really trying to work with everybody as we work through this together.
I would have a question, if I might. Chair Baker, follow up with the city of Dubuque. I have a few things I'd like to ask. If that's okay, I do that now.
Of course, go ahead.
Okay. So I'd like to ask for some perspective of those who are being jailed and how this, if you've made any changes with regard to cite and release. Are we continuing to be, obviously changing the way we do law enforcement so that our jail is not facing overpopulation, as well as reducing the numbers that are in our jail so that our jail staff obviously can practice any social distancing that we can implement there. Chief Dalsing, have you, I know I saw in the police beat that some folks that were arrested were charged with the governor's violation of the governor's proclamation. That certainly isn't a jailable offense. There must have been something else going on there. But I'm just wondering generally if you can address your officers' direction with regard to keeping our jail population down.
Sure. As you're well aware, it is Sheriff Kennedy's jail. It's not the City of Dubuque jail. So we work closely with the Sheriff's Department on this process and who will and will not be jailed. As much as we can, we are citing and releasing. A lot of times that requires that they actually be physically arrested, taken to jail, processed, and then the paperwork filed through, and then they're being released on a citation to appear. There's been some situations, like you mentioned, with the violation of the proclamation. They may have been cited and released, but there have been situations where we've investigated after the fact, like some of I mentioned the major disturbance. As we identified those people later, their arrest warrants were issued for them. So that might be why some of them showed up later on. But again, with the county attorney's office, with the judges, we've been doing our best to make reasonable bonds for the folks that maybe can't be cited and released. If it's a violent offense, people are still going to be jailed. Pandemic is not a get out of jail free card, is the phrase I've been using. But for the most part, it's worked out fairly well. If we come across somebody that has an arrest warrant, we'll check with the jail staff and get their opinion. And if it isn't a serious offense, we'll tell them, make arrangements, get yourself turned in at a later date. So great working relationship with the Sheriff's Department has made it pretty easy. Community following the proclamation has made it pretty easy, but criminals are criminals. They're still going to do what they do. So we're still addressing it. And if they have to go to jail, they'll go to jail, and the Sheriff's Department recognizes that. but for the most part, it's worked out fairly well that we're able to cite and release a lot more folks.
Have we also, have you seen any difference in the amount of OWI arrests? I participated yesterday in a meeting with the Substance Abuse Coalition, and they were asserting that they thought those numbers had been increasing. And I guess I found that concerning.
I haven't looked at the numbers. I can tell you that overall, our traffic stops have seen double-digit decreases. Our accidents have seen double-digit decreases as compared to last year. And part of that is just fewer people out on the road. But as you've probably seen in some other stories across the country, our state troopers are seeing a lot more people driving over 100 miles an hour. And it's kind of one of these things where if the roadway is open, people tend to be maybe a little bit more lax in their driving. And it is a situation that if there's, 1,000 cars on Highway 20, it's kind of hard to keep an eye on all the cars. But if there's 20 cars on Highway 20, you're probably going to notice some of those violations, swerving within the lane, going over the center line, that type of stuff, which could possibly be what some folks are seeing. But, that's just an anecdote of potential why somebody might think there's an increase. But we haven't looked at the numbers, but based on the fact that our overall calls for service, our traffic numbers, and our accident numbers have all decreased, I would be surprised to see a great increase in OWIs at this point.
Thank you.
Yeah, and I guess, sorry, Ed.
Go ahead, Joe.
And just to speak on our behalf, I'd have to agree with Chief Dalsing. Overall, most of our numbers are down. I don't think that our OWI numbers are increasing. When our officers are out there and they see something happening, we expect them to do something about it. So, I'm not sure. I guess I would like to see what the statistics look like, or what statistics Sassy is referring to when they're talking about the increase. Because I guess I've kind of felt like for the most part things have pretty much been down, and and to speak of the jail numbers, I'm looking at them right now, and we have 98 people in the jail today. And just to keep in mind, the Department of Corrections has stopped taking new intakes because they had an outbreak down at the Oakdale intake facility. So 5 of the people that are up here in jail are actually waiting to go to Oakdale. So that actual number that we're holding for our own purposes is actually 93. And I've done this several times, and I want to continue doing it to give credit where credit is due to the local attorneys, both prosecuting and defense attorneys, the judges, and the administration staff up in the jail for working together, and the Department of Corrections. Don't leave them out, for working together to work to get those numbers down to a manageable level. Our numbers, we were averaging in February 190 inmates a day, and we've basically halved that. So the credit goes to all those people, and in addition to the cooperation with the local departments, everybody's agreed that helping us out and working with us and doing more cite and release when possible, and it's actually worked out fairly well from our perspective. So thank you to all the local police departments for cooperating and helping us out with that.
I know the purpose of today's meeting is not this, but Joe, I've put a big star and marked this as a conversation that we'd like to get back to in another work session, maybe in a few months. But looking at, we were successful in reducing our jail population down to 93 that we're holding for our own purposes. Just looking at what can we sustain about that in a new way forward. So I'm looking forward to that conversation as it relates to renovation projects and law enforcement in a different way. So thank you.
Yeah, yeah, I definitely would look forward to having that conversation. But I agree that today it's I don't want to take up the other chiefs' time discussing that issue right now. But definitely something down the road.
I'm going to throw it up to Chief Henneberry from the city of Asbury.
Thank you very much. Thanks for having me, and thanks for everybody doing a great job during this time. Just going along with what the other chiefs are saying, we're seeing a lot of our residents here social distance. It's a lot more education on our side versus citations. Biggest problem we're having in uptick in crime is more with our juvenile crimes. It just seems like they've lost the structure of the school system right now. So those are some of the issues we've been dealing with. We're all ready to get things open and go in again here as Americans, just trying to get back to our daily lives. So.
Thanks. How about Brian? We also wanted to include some of the other types of law enforcement from places like county conservation. So we asked Brian Preston to participate today.
Howdy. Good morning. We're kind of different in that our use has gone way up over this period with COVID-19. Just as little evidence of that, just at the Swiss Valley Nature Preserve alone, in the last 2 weeks, we've had over 3,500 vehicles here. Whitewater Canyon, in less than 2 weeks, we've had 1,100 vehicles. So quite a bit of use above normal. So far, our trends continue that everybody's socially distancing, behaving. We've had a few incidents that our rangers have had to deal with. We're starting to see a little change in attitude. So phone calls we get to the nature center inquiring about camping. It used to be that everybody kind of understood. There's a change within the last week or so that people are getting pretty frustrated that they can't get out and go camping. So we have had a couple recreational campers that we've had to remove from the campgrounds, and they were not very happy about that. But I think the longer this goes on, the more we're going to see the attitudes start to change a little bit and not want to social distance like they have been.
Brian, Dave Baker, I had a question for you. I know that we have discussed that people who are working in essential occupations and must travel for that have been given an exemption by the under the governor's proclamation, and my understanding is they can't just walk in and do that. They have to kind of set that up ahead of time. Can you maybe explain to people why they might be seeing a few campers in some of our campgrounds, but that those are for essential people in essential occupations?
Yep, so we have a form that we have require the people to fill out. They need to call here first, have that form filled out and scanned or emailed to us. Prior to their arrival, I have to sign off on it and approve it. The park rangers give them a laminated permit that they can display at their campsite that tells that they're an essential worker. So unless they have one of those at the campsite, they're not authorized to be there. So it's worked pretty well to this point. I know we have some folks out at New End Park camping, a few out at Mud Lake, one at Heritage Pond right now. So, and there is frustration. Recreational campers see that and they're calling here and wanting to know why they can't camp as well. I get that, but I think it's important that we have that access to those folks so that they can continue to work.
Thank you, Brian.
You bet.
Back over to you.
Supervisor Baker, I've scanned the attendee list. We had a couple other chiefs that were invited, Chief Comer from Piasta, Chief Koselman from Farley, and Chief Helm from Cascade. I don't know if any of them are on the line. I don't see any of them out there. There's somebody with a phone number I'm about to unmute to see who they are, if that's okay. That's the only way I have to know.
I see Costleman on there.
Oh,
Yep, Chief Blake Houseman, Farley PD.
excellent.
Yep, I have nothing to add besides what the other chiefs and sheriffs have said. Obviously, just work on educate, and for the most part, citizens are, they're well aware of the situation, so they're doing a good job that way. We are seeing an uptick in juveniles being out at night, but I think just like Henneberry said, they don't have that structure right now to go along with. So that's all I got.
Okay, I'm gonna see who this is here. You person with last digits 170. Are you a police chief? I've unmuted you. Don't know who that is. So Supervisor Baker, I would say that all of the people that we had reached out to participate, I think that could be on the line, have already spoken. If the supervisors have any other questions, I appreciate the questions that you've already provided. And I think that we just want to make sure that we're in contact through Sheriff Kennedy to all of those communities. We appreciate their participation today, and hopefully that's a helpful thing for the group here and the public. So we appreciate that greatly. We just arranged this yesterday afternoon, and we thank you for your participation. And as Supervisor Baker said, thank you to you and your staffs for all the service that you're providing right now in this challenging and changing time. So thank you very much.
Okay. Thank you, Ed. Thank you for coordinating this. I thought it was an important that we hear from our law enforcement professionals, our sheriff's deputies, our sheriff, and our police chiefs in this regard. And I agree with Chief Henneberry. People are, I think, getting a little antsy. I think the nicer weather, I guess prior to yesterday, has brought more people out. And as Brian Preston said, the conservation areas, recreation areas are getting a lot of use. And I know people drive by, for example, by Heritage Pond and see, 50, 60 or more cars. But, I've watched the pond, and people are spaced out. I think they're practicing social distancing. I can't say for sure on the trail, but I would assume that people are practicing social distancing on the trail. Just there's only so many places to park, so it looks like there's a gathering, but there's really not. And I think people want to get out, exercise, enjoy the great outdoors, but I also think they don't want to get sick and die. So I think from what I have seen, I think the citizens of Dubuque County have been doing a good job practicing social distancing. Not perfect, but I think the numbers in Dubuque County have been relatively low, although concerning, especially, getting into nursing homes and that type of thing. But I think that we've done a good job, and we need to continue that and follow the governor's guidelines.
Thank you.
I'll open it up to...
Thanks to all you folks that participated.
Thank you. Open it up to any of my counterparts. Any comments, questions, additional questions for our law enforcement professionals?
Yes, Supervisor Wickham, I just appreciate law enforcement taking the time to update us on what they're seeing on the streets, so to speak, and I have no further questions or comments.
Thank you.
I certainly appreciate their time today as well and all the work that they're doing. I know that in some of our smaller communities there are parades graduates, high school graduates, and teachers, and social distancing, I think, is happening well out in the more rural part of the county. So I don't have big concerns about that. I do know that we have businesses that are reopening, and it sounds as though the law enforcement and the Dubuque Police Department is on that and responding to calls about people. But like the national news reports, we do see increased traffic and increased folks just generally out and about. So I appreciate everything, that you're truly the front line, and I appreciate that so much.
Okay, thank you. Before we move to the next item, I had a question, and this, I was reading about this on the national level, and I guess I want to at least get this out there, and maybe Ed Raber can check on this, but I want to know if our medical examiners, coroners are performing testing, and do they have availability? Are they able to get test kits? So I don't expect an answer for that, but it's another trending issue, and that can go on for a future meeting. I believe we'll take some research and like maybe to check with our local folks as well. Thank you. Okay. Anything else under the update on county emergency response team? Do we know if Tom Berger's on? We knew Patrice wasn't going to be on. I don't know if Tom is. Mary, why don't we go to Mary Rose Corrigan and see if she just has some an update for us, a general update. And Mary Rose, you can unmute yourself, my understanding.
Thank you. This is Mary Rose Corrigan with the City of Dubuque Health Services Department. I wasn't prepared to give an update today. We are implementing our targeted testing today, tomorrow, and Friday, and we will be providing a daily update or report on the results of that targeted testing going on in the community. We have a wrap-up meeting planned at the end of the day, so you probably won't get that brief synopsis until this evening at some point. Everything's set up and ready to go for the targeting testing. We have reached all the people that we think we need to reach for that. And the nursing homes are also beginning to do their testing for their workers. In addition, we're continuing to work, and you'll hear about our shelters in anticipation of a higher need for that, and hope to show the state that we have a good model for testing. And one thing we are really stressing and in all our communications is to encourage Dubuque County residents to take the Test Iowa assessment, which will greatly increase our chances of being able to be a Test Iowa site based on the data they receive.
Mary Rose and McDonough, just following up on that, the Test Iowa, have we done any kind of campaign to make people aware that we want them to go to Test Iowa? I can't even get my own husband to do it, which is concerning, but he doesn't have any symptoms. I just want him to, maybe I need to find a new strategy. All the same, just looking at what are we doing to push out that message that Test Iowa, the more folks who participate, the more likely we are to actually get a site here, perhaps a test site as well.
Well, thank you, Ann. It's included in all of our news releases on our Facebook daily update. We haven't done a specific campaign about it. There's definitely room to do that as we we've been working on communication and getting the community targeting testing set up this week, but it's certainly something we can work on. One thing I would encourage people to take the assessment regardless if you have symptoms, because it does ask for underlying health conditions, your profession, if you're an essential worker, and then it does provide periodic check-ins via an email back to you to see that you still are, whether or not you have developed symptoms. So I think it's important for everybody to take it as much as possible, and we realize not everybody has internet access, so seek out a friend or relative that can maybe assist with that. Unfortunately, there are no other avenues for doing that besides the electronic assessment, but I'll bring that back to the team and see if we can develop something in conjunction with the Joint Information team to work on a little bit more outreach on the Test Iowa.
Thank you.
Mary Rose, Dave Baker, I took the assessment right away and was not a candidate for testing, but I have received at least 2 follow-up emails checking back on me, and they're a little, it's shorter, just a couple questions for an update, and so I'm happy to keep providing them with the information. And knock on wood, it's everything's good, and I'm not a candidate for testing at this point. But I think it was, I was impressed with the follow-up on it.
Yep, thanks, Dave, and that's just how it's supposed to work.
Okay, thank you. Any other questions for Mary Rose? Okay, thanks again, Mary Rose. Okay, moving on the agenda, I guess I'll ask if there are any other general questions under the County Emergency Response Team on COVID-19. If there are none, we'll move to the next item on the agenda, item B, which is the Board of Health update. At this point, I will virtually turn the gavel over to Chair Tom Beschen from the Dubuque County Board of Health.
Thank you, Supervisor Baker. This is Tom Beschen, and I will state right up front that there is a quorum from the Board of Health on the call. Diane Pate Freiberger, Diane Heiken, Susie Stroud, Todd Lang, and myself. So if action is required, we have that ability. Our portion really is going to has 3 topics: collection kits, which was discussed on Monday. Testing probably the best there would be getting the report or the synopsis from the test group at the testing site later today. And the third part is isolation facilities, which also came up on Monday. We have Alexis Stager is going to share some information with us on that. But at first, I'd like to turn it over to Diane Pate Freiberger for an update on the collection kits.
Thank you, Tom. And thank you for your leadership in contacting Dr. Vanderheiden immediately after the Board of Supervisors Board of Health meeting on Monday. With that, Dr. Vanderheiden did respond back to your email to all of us and directed further questions to their clinical director at United Clinical Labs. And so currently we are in communication with the clinical director at United Clinical Labs. So the proposal back from them was, rather than us purchasing 1,800 test collection kits, they would prefer a concrete plan that would identify the number of days that testing would occur, who would be the population in the community that we are targeting, and also that the number of test kits we want to be supplied to us per day, such as 7 days of 1 to 200 or 2 to 300 collections per day. That way they would be able to maintain the collection kits in the way that they're supposed to be to keep their viability and to keep security with those. They would hold on to the collection kits. They would supply them the whatever number we give, 200 per day, and then the test site would then take those back to United Clinical Labs, processed and sent to Mayo Clinic. The advantage of them being sent to Mayo Clinic are twofold that we've discussed before. The first is criteria. The criteria is more open than the criteria for state hygienic lab for the individuals in the community that right now are being told that they can't get tested. So we need collaboration with the emergency response team testing site. They are also busy with Patrice these next 3 days. So we have asked them for a meeting, but we have received a response back from Patrice. We didn't know who was all involved in the testing, which is a targeted testing these next 3 days. But Patrice's response back was, they're all involved with this the next 3 days. So we are requesting a meeting with them based on their availability, either over the weekend or early next week when they are available, so that we can discuss their involvement, their collaboration, what they have already planned, what we want done. And at this point, we are still waiting for a response back from the clinical director at United Clinical Labs. She was making contact with Mayo Clinic this morning. They are hoping that they would use the collection kits that they have on site, send them to Mayo Clinic, and the Mayo Clinic would send them back replacement collection kits. And the response was they didn't see that there would be a problem with that. I talked to Dr. Bobby Canero late last night after he had a conversation with the clinical director, and we should be hearing a response back through Dr. Bobby Canero later today on that. So we would still be looking at the $147 for Mayo Clinic to process and handle these collection kits. And United Clinical Labs is going to get back to us to see if they are going to charge for their handling, both on the receiving end of the samples and sending them out, and then also distributing those per day to somebody from Dubuque County. So they're going to get back to us if they are going to charge and what that would be.
Okay.
So the plan is to be able to set up a meeting with the Patrice and the emergency response test committee by early next week, and by next Wednesday we should have a plan in place. And this is not for the targeted testing. This is different than the targeted testing they're doing this week. This would be for community testing to see what their availability is, to set up a meeting so we can get this looked at to see if they have the availability also to be doing this.
Okay. All right, Diane, this is Tom again. From the tone of your report, it sounds like the bottleneck of not having collection kits is very close to being resolved.
From what I understand, in talking to Bobby last night, he said that he was told that should not be an issue, that they currently have those test collection kits. They are just wanting a replacement back from Mayo Clinic when they send them there. And that was the only bottleneck in a yes. Okay,
so then beyond that, the issue is working out the details of what is the criteria for testing, if it's something different than the Test Iowa algorithm or the current algorithm, and then the availability of the test site for test collection.
Yes, and again, this is not for targeted populations. Those right. are all targeted with the collection kits that are provided by IDPH. We are looking at community testing.
Right. Yeah. But still, there has to be some, I would think there'd be some guideline on who is eligible for testing, or are you talking about just opening this up to anyone that wants to come in?
Tom, we would not be able to open it up just to anyone who wants to come in. The testing site committee has already worked on, at least they had reported that they have worked on a system that people would be able to either call in or fill in an assessment, so that people would still need to meet some sort of criteria. Okay. And that just and they would have to have an appointment, and they would not just be allowed to just show up.
Okay. So that needs to be worked out yet, and that's the purpose of the meeting late this week or early next.
That is correct.
Okay, thank you.
This is Ed Raber. If I could make a further statement, Supervisor Baker.
Of course. Actually, Chair
Yeah.
Beshin is.
Oh, right.
Yeah.
Right. Chairman Beshin.
What's the question, Ed?
Oh, I just wanted to make a further statement from what Diane said.
Okay.
Diane reported some information about the testing, and there's some costs associated with that. I do not have an answer for that, but I'm sure that a question would come up: is what does that look like? How do we deal with that financial situation? I in the last 48 hours have begun to try to pull together with some people that are engaged with FEMA and some other federal resources to figure out how what we would do would be something that we could be requesting reimbursement federally for. So I don't have an answer for that, but I just wanted to let you know that I'm trying to figure that out, and the people that I talk to say there isn't a clear answer, so we just continue to work with that. I think there's going to continue to be some additional meetings coming up with FEMA and potentially some other federal agencies. So I do not know what that looks like, but we are pursuing that to try to get a better understanding.
At this point, Ed, I would add that the group that's working on this is pushing forward very quickly. The question of cost right now is if need be, we're looking at utilizing the money that has been allocated to the Board of Health for COVID-19. And that could be a sizable chunk if we look at the $147 charge from Mayo Clinic times 1,800 test kits. I think the math on that was somewhere in the area of $240,000. But, hopefully there is another source of that funding. But in the interest of getting this done, we're pushing forward with that backfall. Okay, is there anything else for Diane? Thank you, Diane. Hearing nothing.
Chairman Beshin, this is Supervisor Wickham. A question and maybe a thought, if anyone else has done it. I'm not sure who is the testing site committee, that group that's working on the list, but a question or thought for them if they're going to be determining who's going to testing. Why wouldn't we partner with the state of Iowa and use the Test Iowa database from Dubuque County, and those that are already eligible or approved, they would be our first candidates for testing, along with potential other essential workers if they didn't sign up. One of probably the reasons for relatively maybe or moderate signups in Test Iowa is people don't believe it's going to benefit them. They don't believe they're going to get tested. And so if we're interested in having Test Iowa more used throughout Dubuque County and the state of Iowa, showing them that if you sign up and you do qualify, you have a shot at getting tested. That would be, I think, a strategy that would be a winner.
Jay, this is Diane Pape-Freiberger. Tom, may I answer this?
Go ahead.
Okay, the criteria, when you fill in for the assessment for Test Iowa, yes, the long-term care workers, the essential workers, and healthcare providers are prioritized with becoming eligible. So there may be some of those that have not already been tested, but beyond that, it's the same criteria that the state hygienic lab currently has. By us using Mayo Clinic, we are able to open that up to people that have been exposed to, and that have not been identified through contact tracing. And so with that, in fact, I've sent a draft to them of who I feel should be prioritized as far as testing if we do not have to use state hygienic lab criteria.
I mean, that sounds good. I mean, I would just assume that if you got the Test Iowa database from Dubuque County, Governor Reynolds yesterday said there was over 300,000 people that have already gone to that site. And if you extract Dubuque's population and then extracted who might be eligible or just theorized on that, you'd still be dealing with thousands that would have that need. And so my question would be, can we reach out to the state? We have a great track record of 1 day or 2 day now of being a partner with them. Let's see if they would be interested in sharing that database with us to have those people be tested.
Supervisor Wickham, this is Ed Raber. If I could say something about that, I think that's a great idea, Jay. It reminded me that we perhaps should not gloss over the fact that on Monday or was it yesterday? They all run together. I apologize. I think it was yesterday. During Governor Reynolds' daily press conference, Dubuque County was featured, and Patrice Lambert, her audio was on the press conference, and we are the first county that the state has decided that they wanted to collaborate in some form. I think, as Patrice has noted, we've offered up a couple different scenarios about what that collaboration could look like. And right now, the one that they have chosen is the one that's going to be happening in Dubuque County today, tomorrow, and Friday. And as I've talked with several of the Board of Health team and Patrice, just because the governor's administration has rejected some of those other ones, that doesn't mean that they've rejected them forever. I think that you're right, Jay. We need to continue to say that that's the next step, so that what we have now is a first partnership with the state on how we can collaborate to get testing done here, and we need to continue to push them for that next step, which is probably what you just pointed out there, Jay, some sort of access and collaboration with that Test Iowa assessment. So we need to keep going back to the governor's office to say how this is working, and we need to take the next step with them.
Supervisor Wickham, this is Diane Pape-Freiberger. And I would like to see that information that the state has from Dubuque County residents, so that there are probably some in that database, but there's a lot that have not filled that out. We're very much aware of that now, that have not filled that out. Those are the ones I'm concerned about, because maybe they haven't filled it out because they feel that they're not within those guidelines of even being tested. And those are the ones that are going to fall between the cracks. And we don't want them to fall between the cracks, but we definitely could utilize the information provided by Test Iowa in addition to offering it to other members of the community.
Yeah, I would definitely agree with that strategy. I think that would be very, very good. And my this message would be, I would not wait till next week just to meet to discuss that with a group. And so if there is a testing site committee, if we can add additional people to that and they can come up with a list or categories of people that we would like to get tested, and we now have access to test kits, let's not wait 4 days We're staring down a May 15th opening in Dubuque County, unless the governor changes something. And if we can get on testing, every day counts. And so I would encourage the group and be happy to participate. And I'm very happy with the results we've had in the last couple of days. We've got some good momentum, as I mentioned on Monday. Let's keep that going and keep the work and the activity related to testing ongoing.
My question.
This is Diane Heiken. Oh, I'm sorry, Supervisor McDonough.
Well, I was going to ask if our Board of Health does a great job with short targeted committees, perhaps help Mr. Raber get the word out about Test Iowa. And because I think as those numbers come up of the numbers of folks in Dubuque County who do get registered with Test Iowa, that increases our likelihood that we look like a greater partner as well, and more likely perhaps to bring Test Iowa here. So, ways that we can put that message out and increase our numbers, that would be very helpful. And I think, we have incredible people on the Board of Health that might be able to help Ed get that done.
This is Diane Heiken. I believe we've already asked this question because it was in Dr. Canero's submission over the weekend. And Diane Pay-Pryberger and Tom, maybe you can help me understand this. But his suggestion was that the first site would be for screening high-risk individuals within the community, and it would be the population would be those that are eligible for testiowa.com but have not been tested as of yet. And I believe Patrice, when she addressed the new testing initiative on Monday, she said that we asked the state for this information and for this ability to get that data, and the answer was no. But since she's not here, I don't want to say that for sure, but my understanding was we have already had that request with the state and that we weren't able to get that data, but we will clarify that with her and definitely address it. But that was one of Dr. Canero's suggestions, and so we had been looking at that since last week. Diane, do you remember this conversation or this?
Yes, I do completely.
Okay. And I was looking for an email with Patrice's response, but now, if my memory serves me correctly, I believe she addressed it in the meeting on Monday. But those of you that didn't have the background knowledge that we had through the emails, maybe it didn't make sense to you, or maybe it didn't come across that way.
I remember that, Diane Heiken. This is Ed. My point in bringing it up was that they said no, but that doesn't mean that they'll always say no. And I think the returning to the question with the state will be helpful, hopefully.
Yeah, I agree. I mean, this is a fluid situation. So maybe after some of our results this week, even with tonight's summary, as Mary Rose Corrigan talked about, maybe that will give us a new direction that we can use to approach them.
And I know that Patrice has not given up hope for additional help from the state. In her talk at the press conference yesterday, she said she's happy with what's happened to date, but we still haven't gotten all we've asked for. So.
And Supervisor Wickham, I would like to read a response that we received back this morning from Patrice. After we requested to have a meeting, we were ready to meet today. But because we need the collaboration of the system that's already been set up with the testing site committee. And she responded, in all honesty, I do not believe a meeting can occur this week due to the current testing and all of our schedules. Early next week would be much more feasible. And so we as the Board of Health can meet, but we may be trying to reinvent the wheel that they already have invented. They're the ones that have this test site planned. They have the staff planned. If we went in and replanned it for them, it may not fly.
And this is Diane Heiken. I just kind of want to give my opinion on that, Diane Pay-Pryberger. So the email that I sent out this morning wasn't sent to Patrice. She was included on it. It was sent directly to the chairman of that committee. And I didn't expect a response from any of them since I knew they were busy today. But I don't know that we necessarily need the cooperation. I'm not sure what the word was that you used, Diane. But I'm at this point, I'm almost ready to move on to a plan B and come up with our own. So I just want to put that out there that we've been talking, about trying to communicate with that group for a long, long time. And I almost think maybe we need to start looking at other options. I'm a plan B, C, D kind of person. So I think we just need to have that out there as a possibility.
And Diane, I do not have a problem with that, but the one person we definitely would need to be part of this conversation is Patrice.
All right, we included her. I'm just saying I didn't expect to hear a response from her this morning, but I did send the email directly to the chairperson of the committee. So I expect some sort of a response from them, if they're at all interested.
Okay. Supervisor Wickham, thanks for the suggestion on using the Test Iowa database. We will certainly pursue that as a possible option. We need to meet and discuss this with the site committee, so we will take it from here.
And so we're going to wait for 4 or 5 days? That's what the Board of Health is going to do, is wait for Patrice?
That is correct.
I believe that's a failed strategy.
Okay. Thank you for your opinion. All right. Isolation facilities, if I could ask Alexis Stager to provide or to give her update.
Supervisor Beshent. Hi, this is Alexis Steger, the Housing and Community Development Director at the City of Dubuque. Thank you, Supervisor Beshent.
All right.
So, I'll just do a quick summary of the memo I submitted and be happy to field any questions that come up from that. So back in early March, the City Housing Department started assessing the homeless shelters and our other large census shelters to see what their ability was to isolate any of their residents that happened to become ill. And during that assessment, we also brought all of the information from the public health and CDC to help educate on how to keep those residents also safe while they're there and not ill, and try to keep them from getting ill. So while we were doing that assessment, we found that our large census shelters did not have a way to isolate one of their residents that became sick. And so that kind of mobilized the idea that we may need another location to do that. So the city was allocated a community development block grant for allocation from the CARES Act. And with that came some ideas of what that funding could be used for, and one was a temporary isolation shelter for non-congregate housing. So we continued forward knowing that there was some funding that would be available to back that, and sought locations that would be best for that type of isolation should we need it. Very quickly, at the beginning of April, we had the first resident that needed to be isolated. So we quickly continued to get procedures ready, finalize locations, etc. I believe it was 3 days after that, the next resident needed to be isolated. Quickly after that, 2 additional. So we had the need come on very quickly. Luckily, we were able to respond quickly. So we have 2 locations. We have a primary shelter that is apartment style and has capacity for 21 residents. And then we have a hotel style secondary shelter that has capacity for 60 residents. It's the secondary shelter because it has a lot of challenges that the primary shelter does not have for the safety of the building, the safety of the residents, and just best isolation practices. But it does still work. It just takes more operational staff time to make that one run. So our daily operations, so our health, we worked very closely with the public health incident management team to make sure that our healthcare providers knew that this was available for the city of Dubuque. And if they identified somebody that came for testing for COVID and they were unable to shelter at home because of a doubled up situation, that we also wanted to be able to serve those residents. The last thing we wanted was someone to go home to many, many people in their home and they're unable to isolate, as we assume everyone has maybe a spare bedroom that they can do that in. That's not the case throughout the community. We have doubled up families that that just is not going to be feasible. And so we're looking at protecting those residents. So we worked with healthcare providers and the VNA contact tracing staff to identify those residents that may be in need of an alternate location to isolate. So that's our referral system. It comes to them. The homeless shelters can direct refer if they have any residents that have any symptoms at all. So those are the three organizations that refer to us. And then at the primary shelter location, we have 24-hour on-call. We use cameras for building security and security of the residents. And then we're there to serve lunch and dinner. And we have quite a few partners that help us do all of this work, including Dubuque Rescue Mission, Project Rooted, First Congregational United Church of Christ, St. Patrick's Catholic Church, and then we've had many other organizations donate time to this shelter as well. But the city staff is in charge of that, running that shelter currently, and those are volunteer staff. Now they do get paid for that. However, it's not a sustainable staffing model, and we have been looking to have a nonprofit or another organization be able to take over the shelter operations. What we found is, unfortunately, from conversations with insurers and some of those nonprofits, is that if you do not have the current insurance for frontline staff for this type of work, you will not be able to obtain it. Insurers are not going to provide it to those that are already not covered. So we are running into that as a problem. However, we are going to release a request for proposals to see if there's other entities out there that do have that coverage that may be able to help with that staffing and operations of the shelter. When I say it's not a sustainable model for staffing, we have employees such as our city attorney and our assistant city manager, myself, another director, that are staffing the shelter. And obviously, that's not sustainable, and that we have to be working on all of the other COVID efforts in the city as well as our regular jobs. The funding for this, like I talked about initially, is that Community Development Block Grant allocation from the CARES Act, and that's an entitlement to the city. So the shelters can only serve under this funding source, the city of Dubuque residents. They have to live within the city limits, and that is a restriction of that funding. That's because the entitlements for the city, and outside of the city, the Dubuque County can access that funding through the state. And I believe ECIA got some allocation, not specifically for shelters, but from that same allocation. So we have to specifically serve the city of Dubuque under that funding source. We are looking at moving towards a FEMA funding the non-congregate shelter, and that we could use that CDBG as the 15% match that is required. And we need to do a declaration and then do a submission to FEMA that non-congregate shelter is needed. We've proven that there is a need. We're already sheltering people, and we expect that need to very potentially go up now that the County Board of Supervisors has funded the testing that's going to be happening, the targeted testing happening today, tomorrow, and Friday. We're just going to see more people being identified that possibly cannot be sheltered at home and isolate appropriately. So generally, that's kind of the shelter situation that we have currently. And if you have any questions, I entertain those.
Alexis, Supervisor McDonough, what is a non-congregant shelter? What does that mean?
That means that you're not put together with other people. So congregate shelters are like homeless shelters where everyone shares space. They share bathrooms. Things are shared in a congregate setting. Non-congregate means that you do not share those spaces.
So you have a private bathroom?
Correct.
And do you have your own kitchen facilities too?
In the primary facility, you have 100% of the kitchen facilities. In the secondary shelter,
I don't know the difference between which one's congregate and which one is non-congregate. Those are words that are, pandemic, but I don't understand the distinction. In which of the shelters is apartment style with private bathroom and private kitchen?
That's the primary shelter.
Okay, and you have capacity there for 21, and how many people are in that now?
We have 2 housed currently.
Okay, 2. And are we having individuals that are recommended to go to shelters or to these locations, and it's not happening?
It is up to the resident. We have had a couple that declined, although they were identified as potentially needing to, and they declined based on family situation. So there were a couple that declined, even though the VNA had referred them to the shelter.
And so what are we doing to remove their barriers? Obviously, we have a medical opinion saying that they should go. They're choosing no. What are the barriers that they have, and are we working? I don't necessarily need to know the barriers. Are you removing the barriers?
Yeah, we're working to remove any barriers that are perceived or otherwise. We work with a lot of our, just as a city, work with a lot of our vulnerable populations, and those are obviously the ones that we're going to deal with the most now are those vulnerable populations. And we have different people throughout the community that have connections, and we are 100% bringing those people into the conversations to help understand what the shelter situation is, why it's needed, that educational piece to remove those barriers. We're using a lot of partners to do that.
Is there anything that the Board of Supervisors can do to assist you?
In removing barriers or in shelter in general?
It's a broad question. You've never been before us before. You have a different role to play. You're not part of the incident team. We're asking if there's something that we can do to help you.
Staffing is still an issue. So if that's the one thing that we're going to continue to run into is that the ability to staff the operations of a shelter are a community-wide difficult situation. So if the county board had a solution for that, wants to do the operations of the shelter, that is something that we're going to need help with. And we're trying in the community, but if the Board of Supervisors has a solution, we absolutely are open to that as well.
Well, we don't have a hidden solution, but we could be, if you need additional folks to be working more outside the box. I know Mr. Raber is familiar with the housing department, certainly having come to us from your offices. He maybe just needs to be empowered to start tracking down other ways we might partner. I don't know, Ed, if you want to jump into this. If you know, I've never been asked before to even offer any kind of assistance with regard to this. You know, one question I have is, do we need a shelter that is outside the city of Dubuque? Do we have a countywide issue? Have we thought about that? The community block grant dollars for these shelters are only for City of Dubuque residents. That's where the funding comes from. Should we be looking at that to be proactive? And then also, if there's a staffing issue, Ed, maybe you can help facilitate what we might need to do to be a better partner with the city.
And this is Tom Beschen. I think where you're going is the second part of this conversation. What we've learned from Alexis this morning is what the city's been able to do, but we've also learned that because of some restrictions on funding, that's limited to City of Dubuque residents. There is a process going on right now to qualify through the Dubuque County Health Department, Dubuque County residents through a FEMA solution. It involves an emergency declaration that Terry Goodman is working on. I have not seen it yet, but that will be an action the Board of Health will have to take. in talking with Patrice, she doesn't think that the incident management team can really do as much as what the housing department has in terms of needing a facility outside of Dubuque. That really doesn't make sense to duplicate. If we've got capacity for 120 or 100, roughly 100 people, hopefully we've got enough capacity. I think if we can latch on to and support this process that the housing department has developed, it would be in the best interest of both groups, the city and the county. Ed, do you have anything to add to that? I have not seen anything from Terry Goodman this morning.
Correct. Thank you, Chairperson Beshen. Supervisor McDonough, I think you're exactly right. As an issue, and the focus that turns it back around to the Board of Health sort of emerged rather rapidly last night, and I have been in conversation several times yesterday with Alexis Steger at the City Housing Department. I think first and foremost, the next action item that may come before the Board of Health is, as Tom Beshen noted, what may allow us to be that better partner with the city of Dubuque, and they with us, is there is a proclamation or a declaration that FEMA is looking for from the Board of Health, not the City Council of the City of Dubuque or Dyersville or the Board of Supervisors, but from the Board of Health, that would allow, firstly, these emergency expenses being incurred for this non-congregate shelter to be reimbursed by FEMA as part of their declaration. And I've also talked with Tom Berger from the EOC a number of times yesterday. So that coordination, I've engaged that coordination and figuring out how we will work that. We don't have yet a draft of that proclamation, which I appreciate our partners, the City of Dubuque, working on that. I believe that they're also trying to make sure or looking to see if a proclamation, if we do that, that it may have broader implications for us that might not just be about simply non-congregate shelters. So that I anticipate that will be in the board packet as a item to consider and potentially take action on at your next meeting, which I'm anticipating is Monday. So that will be a big step that will, I don't think in my conversations with Alexis Steger that she's indicated that they have the right number of sheltering beds. It's hard to know what that number is, but just as they went and secured for a slightly different audience, thinking that it was going to be for potentially homeless people that couldn't go back to a shelter. Now it's kind of morphed or evolved into potentially some other different needs that they have a backup too, and it may be good to have a backup for the backup. So that doesn't mean that backup has to be not in the city of Dubuque. What we're saying is that there should not be a barrier for a person that lives in Dubuque County being able to use that regardless of where they're going, because it won't be strictly city CDBG dollars going for it that are supposed to be targeted for the benefit of city residents. We're looking at this to be a more collaborative and open thing, not with the use of CDBG funds. Another benefit of that is that the city might be able to use part of their allocation for another purpose that is also needed. I don't know what that is, but I'm sure they'll find it. So I'm hoping to have more information for you about that on Monday, and I'll continue to be in contact with partners like Alexis at the Housing Department and probably Human Rights Department and some other places, wherever that leads. And I continue to have excellent connections and guidance from Tom Berger, and occasionally from, as we talk about this federal FEMA reimbursement with other partners, even at ECIA, Mark Schneider. I'd like to note that if I could, I spoke about this yesterday with Denise Dolan, who I believe is on the call. FEMA is doing some initial kickoff meetings. This morning, they did a kickoff meeting, which is just an information sharing and sort of meeting with the city of Dubuque. They informed me about that. That happened earlier this morning. Last Friday, there was a kickoff meeting with FEMA and I think Homeland Security with Dubuque County. And although I was not on that call, but Denise Dolan and one of her other staff, and I think Tom Berger were on that. So there's going to be another follow-up to that. In fact, a collaborative city and county meeting coming up. I don't know the date of that, but coming up soon. And so we will be, I've talked about this with Don Sherman as well. We'll be making sure that the county has people there at that meeting so that we are engaged in figuring out how we partner with FEMA on these projects, especially since it allows us to be more directly collaborative with some of our partners, whether that's the city of Dubuque or some other communities nearby in Dubuque County.
I would like to be included in that phone call that you're speaking about. And Alexis, I'm delighted that you're here. And I would like to extend an invitation to have you come back before us again. My questions throughout have been about the overflow and the isolation preparation. And I want you to know that, at least from my perspective, it is a high priority, not only for the Board of Health, but for the supervisors. And so if you can help us think of the ways we can be helpful, I want you to know that you are invited to be back, at least visiting with me and before this board.
This is Diane Hyken. Can I ask a question of Alexis? Alexis, are you there?
Yeah, go ahead.
Okay, thank you. I have to leave the meeting, so I just wanted to clarify. So, well, first of all, thank you for what you're doing so far. I appreciate you filling that gap. But I wanted to just clarify that if we can give you some sort of a statement from the Board of Health, then that will enable you to apply for the FEMA funding. That will help kind of with day-to-day expenses of operating the shelter, staffing, meals, et cetera, things like that.
Correct. Yep. FEMA can pick up all the non-congregate shelter stuff. So operations, supplies, everything that goes with that.
Okay, because I know the meals that you mentioned, now you've had a census of, 5 at the most. So the meals that you're getting right now, you're accessing the community meal giveaways from those agencies, correct? You're going when they're doing their regular meal giveaways and you're picking up meals for the people that you're housing right now.
Correct. Yeah, we had conversations with them asking if that was something they could support while we had this lower census. I believe they also are okay with supporting it when we have a higher census, as long as they have awareness ahead of time. And we were looking at, as higher census goes up, that they get a monetary contribution for all of that food that they are preparing for us. So it's not just always giving it to the shelter. Right now, we were just doing for the low census. They were able to serve under their current situation.
Right, but that would be one need then. We don't have a real high volume meal program in place right now because it wasn't necessary. So that would be one need. If the census goes up to 100 or 120, as the beds would allow, we would need funding for that probably. I'm on the Board of Missions and Social Concerns and the Cafe Ministry Steering Committee at First Congregational United Church of Christ. And I know that we would probably step in and help, but I can't speak for the whole church. But yeah, that's a big difference going from providing 5 meals on Thursday night to, more extensive meals. So, that's a very real need at the shelter that could be addressed by that money. I just wanted to clarify.
Yeah, absolutely.
Okay, Ed, I would. This is Tom Beshin again. I would ask that if it's determine that we have to act before Monday, let us know so we can pull that action together. Alexis, I want to thank you for the update too. You know, it's things like this that can help both ends if the county and the city can work together. We sometimes we draw lines, and sometimes it's better to cloud those lines so we can do one thing and accomplish it for both groups. Thank you very much.
Thank you.
Lastly, if I could add, as we put this to bed, this topic, my understanding is that the proclamation or declaration has a retroactive clause, so we would not be missing something. So because it's of the emergency nature of it. So I've been advised that doing this on Monday, even if something happens between now and Monday, would not preclude us from pursuing that reimbursements request back to FEMA, which those requests may not come for a few months or something like that.
Okay.
It's a reimbursement.
Okay. Thank you, Ed.
Tom, before we leave this, I just have one comment or question. You know, we have had before us within the last 2 weeks the isolation guidelines, and for Patrice to be able to use that authority to instruct individuals that they need to be in. And I'm one for trying to get cooperation before you pull the strong arm. But that is still a possibility in case we need to have someone isolate that is resistant.
That is correct, Diane. And if that were to be invoked, it would require within 24 hours a special meeting of the Board of Health, since at this point we can't delegate that without taking board action. So if that happens, we have a call to action, and we'll do that. So I see that as a tool that may have to be used, as Ann said, to remove a barrier.
Thank you.
Okay. All right. Is there anything else for the Board of Health? That concludes our agenda. Hopefully everyone will have a lot more information about the testing today after they get through the first day.
Thank you again to all of our members of the Board of Health, and Tom, for you, your work on this and your persistence. I really find it remarkable that volunteers stepped up to be on our Board of Health, and that you're carrying the day in so many ways. So it is certainly, we have much to be proud of in Dubuque County, but let me thank you again.
Thank you. And thank you for all the other board members too. Chair Baker, I'll turn it back to you.
Okay. Thanks, Tom. All right, and I would also like to thank Chair Beshen and all of our Board of Health volunteer members for their hard work and diligence. When they applied for to be on the Board of Health, nobody had a crystal ball to see what they were getting into. I think they've performed admirably, and I think that the citizens of Dubuque County are blessed to have these folks serving on the Board of Health. All right, is there anything else on the issue of COVID-19 before we move forward? I'm just kind of doing this as a general catch-all to see if we missed anything.
I would only like to add, Chairperson Baker, that I echoed your comments. It has been, I've never met most of these people, but I work with them every day, and it's been fortunate to have such dedicated and knowledgeable people, and I just hope that I've been able to play a assistant role to helping them move those issues forward. But I I am very, very appreciative of the people on the Board of Health and their staff, Tom and Patrice.
And thank you too for helping pull these pieces together. We are moving quickly, and you are juggling those tasks as well, moving with the Board of Health. We're moving at a speed that we couldn't do without you, so I appreciate what you're doing also.
Thank you. That's it.
All right, thank you, Ed. All right, we're going to move to item C on the agenda, Dubuque County Emergency Loan Fund. C1, resolution approving the contract for services with ECIA. Go ahead. Is it Ed? Are you going to give input on this?
I was going to do. I sensed that somebody else wanted to speak there, but let me tee this up just briefly here. In your packet on page 17 of 32 is a resolution. I drafted that. Wait, is that the right one? Nope, that's the wrong one. Circling here. Well, as I try to find that, I believe that there's a resolution that Dawn included in the packet related to the contract here. On Monday, there were some questions brought up that I thought were really good questions. I think from Supervisor McDonough, and although I think Matt Specht is on the line here, if someone wants to unmute Matt. Matt and I talked yesterday and worked this out, and I believe that they are on the agenda page. They've been uploaded there, so they're accessible. I emailed you this morning a slight revision to the contract as requested from Monday, which does two things between the guidelines and the contract. The guidelines now reflect that this is not an open-ended program. We have just picked the date. I touched base with Supervisor McDonough about that. Picks the date of December 31st, 2020, essentially the end of this calendar year, as the end of the window for a business that wants to apply for this. That's probably generous. Most of the applications will occur probably this summer, but I don't know that. But in doing that, in the contract, assuming that the application window is there, this is essentially a 3-year loan, and we would be asking ECIA to continue to service those loans through the life of the loan, which would be December 31st of 2023. And so if that was the change that the supervisors were looking for, at least in that issue, we've tried to correct that. Matt and I highlighted that text so it's a little bit easier to find in what was sent out this morning, and which also appears as an update on the board website under this agenda item. I believe that County Attorney C.J. May, he and I talked about this again yesterday, and I think he sent some written notes that he had reviewed it. Didn't have any problems. So that's but one part of the contract. That's the part that I was asked to check on. There are probably some other issues, and I didn't know if Supervisor Wickham wanted to, if he was the other individual that was looking to chime in. But that's how I'm teeing this back to the board.
Ed, I had a question.
This is Supervisor Wickham. I'm comfortable with the program, so I defer to my other colleagues and any questions or concerns they have.
First thing I'll comment is I will be supporting this. Believe that the need is out there, and I had a little consternation, I guess, because we have a revolving loan program that is a little underutilized, but I think that this is a different criteria, and I think whatever we can do to help our small businesses, I think is the right thing to do. I did have a question. It's on page 12 of 32, at least in the hard copy that I have. And about halfway down under FAQs, it says when it repays its loan, we will be able to lend it again to other businesses. I'm assuming that means if it's done within the timelines that you've now entered into this agreement.
Right, and actually I highlighted that. That's a decision that the Board of Supervisors can make either now or later. You may not want to establish any revolving loan fund with that. You may just want to pull that back in. I highlighted it just to make sure that you were aware of that. That was some text that Matt provided. You're not bound by that. That's not sort of anything that's requiring you to do that. You could use that to revolve into the future if you wanted, on your own or with ECIA business growth, or not to do that.
So I just thought I just wanted to make sure it wasn't expanding the timelines, and I think it was a very good catch in addition to the document from Supervisor McDonough that, you know, we have a closeout date, and I believe this is a good program, but all things should have an ending date. Well, except our firefighters and ambulance providers. I didn't want to cause any concern there, but because we have a revolving loan program for them that's ongoing. But I think in this case, having a timeline is important.
Ed, I have a question. In the document, and I can't put my hands on it right now where it is, there's a phrase that I think ECIA was hoping that we would have a board, a committee that would review some of this as well, that there'd be county members. So, you know, how is the logistic of that going to work? And also the question was, where is this funding drawing from? I know we have our USDA loan program that's ending in terms of our own loan from the USDA. But specifically, Stella's going to want us to assign this to a department and an account. I know that the money's being transferred, the full $200,000 is going to ECIA now. So we're going to have to make a budget amendment depending upon where this is coming from.
I must tell you, Ann, am I unmuted? I don't have that of the detail. I've been working on this contract side, so it's kind of up to you where you would like those resources, whatever number you'd like to allocate, and how that would work. And in terms of committee, I think ECIA Business Growth has their own kind of a loan review group that, based on the guidelines, they pass those through based on the guidelines that they provided. So I don't know that that requires any further action.
I think Supervisor Wickham serves on that that board and committee. Right.
I'd like to add, you brought up another point that I investigated yesterday, and that Supervisor Wickham brought up on Monday, and that at the end of the day, I was able to speak with USDA Rural Development Director for our area, Steve Lucina. And I just wanted to make sure, there was some question about the end date of that loan, and I double checked with him. And actually that loan date that you have with the USDA is actually in 2025. So it's just a little bit further out, but I think that as Mr. Lucina and I talked, I think that there's a wide variety of things that you can do, and I think Supervisor Wickham pointed to those on Monday. It's just that the time frame, to the best of his recollection, based on he's not in the office, he's sheltering at home, so he didn't have access to the hard copy, but from what he was able to pull up, it looked like it was 2025, and you can't prepay it. You can probably prepay your car loan, but you can't prepay this. But I think that there are some real exciting opportunities if you wanted to keep the fund engaged in that sort of thing when it does mature. I think Supervisor Wickham was correct that there are some things that you can do with that, and planning for that before it ends. Planning in 2024 would probably be a great time to start looking at that.
I would ask Matt Speck if he has any comments on what he had in mind for review and approval of the applications. So if we can unmute Matt. You should be able to speak, Matt.
Am I on mute? Can you hear me, Chairperson?
Yes.
All right. Yeah, so just to a point of clarification, we're actually been, myself and Don Danielson here, another person at ECIA, have been approving the Dubuque Initiative loans. Any loans that we maybe have a few more questions on, they did appoint a very small committee. So that's kind of where that's referenced, Ann. That small committee where, hey, we got a couple questions on this one, kind of what's your, we'll take it to that committee and say, hey, kind of, here's what we're thinking, just to get, I guess, a second set of eyes looking at it on certain applications. So
it's page 5 of 32.
Again, we're just trying to keep this extremely streamlined and getting responses back out to these borrowers as fast as we can. So again, that's why we only call on that committee as needed.
I like the idea of streamlined government. Thank you. Okay, any other discussion? This is properly on the agenda. I believe we need to take action for several reasons. Obviously, if we're going to approve it, to move it forward, and Stella Rundy, our budget director, needs to get her final budget amendment put together. So is there any other discussion on this proposal?
Well, I think it would be helpful to have Stella. I'm assuming she's with us this morning. If she is there and aware, and kind of have an understanding with her that we won't spend money without having some discussion about where we're going to pull it from. And, you know, if we're using the general basic, I think we should be.
Hi, Ann, I'm here.
Yes, Stella.
Good
because
morning.
This is going to be a $200,000 transfer directly out. ECIA is going to hold the funds.
Yes. I have been wondering where you have been wanting to fund this. I think general basic would be our only choice to pull funding at this point. And I think I would assign it to our economic development department. We have a small department managed by Auditor Donlin.
Okay.
So that's where I would assign it, and that's where I would pull the funding. I know the $200,000 was thrown out as a number. I don't know if that's been decided upon as the final number as well.
It's in my final draft. I'm assuming that's what we're going to be. I don't know if there's I think the resolution is going to approve the final draft, and what I have says that that's $200,000 is going to be transferred, and ECIA will hold it.
And I'll speak from our discussion from the last meeting and the research that I've done in between meetings is that the $200,000 should be sufficient to satisfy the anticipated need under this. And Supervisor Wickham, I think you originally had given us that detail at the last meeting, if you want to jump in.
Yeah, I think the $200,000 funding level is appropriate.
Right, and I don't read this as anything other than that's the sum total. It's not as if this is to begin or the first part of. That's the sum total of the program, and there'd have to be something extraordinary to show us that needs to be modified, right?
And I believe
Well, Dubuque
doesn't establish the revolving loan fund, so it would be this one-time loan fund.
Right.
Yeah, as an example, Dubuque Initiatives funded theirs for $2 million, but they've only issued around $400,000 of loans. Mm-hmm. So it's those that qualify and those that are interested. Certainly, we are in unusual times, and the longer that we go with businesses being shut down, the greater the need will be for these business owners, as you know, Supervisor McDonough, for liquidity and revenue, and financial assistance. But right now, I think $200,000 is a good mark, and I fully anticipate that will serve Dubuque County's needs in the near future.
This is Ed Raber. I had just a couple other things to mention. Firstly, as Supervisor Wickham noted, Dubuque Initiatives had a large amount that they were starting with as a potential pool, and then they have not loaned all of that out. I'm saying this as kind of a newbie still here. Today is my 1 month anniversary. I don't actually know how you do that, so that I don't know that we would be transferring $200,000 to ECIA. We may just sit on all of those resources, and when Matt and his team make a loan at the time of closing, they would just invoice us, and the county would forward those resources on to them. So it, just as an as-needed basis, if that's a practical thing, that's probably...
It's not in the contract, Ed. Page 5 of it is not. Scope of services, attachment A. It's
to deposit.
Yeah.
So, right. So if yep. So there you go.
And this is Matt with ECIA again. Just to keep it streamlined, it does go a lot quicker once we get an application. I mean, we're getting people's ACH numbers, and we're trying to get these funds transferred as quick as possible. So there probably would be quite the delay if we had to request that amount every time.
Right. Something, Matt, I'm glad to have here. I'd like to know. I am ready to move forward, but I would like to have some direction that you're going to be reaching out to all of our mayors throughout the county to let them know that this program is available. I see Denise has her hand raised. I think that unless she's waving to me, I think she wants to make a comment.
It's nice to see you, Ann, but no, I did have a couple of questions about this. The way I see, or the way I read this last night when I saw it, we would write a check for $200,000 to ECIA, and they will have to somehow or other do some accounting to us as to how much they've dispersed and the payment schedules, et cetera. That, I guess, will be up to you. I didn't notice anything in there as to exactly what accounting they have to do to us, but that is something we can discuss. The other issue that I saw, my understanding is this is a revolving loan fund. How long do we expect this to continue?
Right. And that is not in this document that you would have received last night. I think it's just in this morning's packet. The end date for the new applications to be considered is the end of this year. So there is an end date on when new applications will be considered, but of course the term of the loans are 3 years. So that's the time frame. Those are the two pieces, the 2 dates.
So this is Stella. Can I jump in? I think what we need to address, what Denise is saying, is when are we repaid? So at December 31, whatever is not been loaned out gets transferred back and annually, or how are we repaid our funds from ECIA?
Mm-hmm. Gotcha.
And Denise, hey, this is Matt with ECIA again. I mean, and we can set that up similar to what we do with the county RLF, where we send you monthly, or if you want it 6 months, or, once we start collecting payments again.
Well, and Matt, right now, on that one, we do the accounting. That we give you the check at the time of closing, and then the funds are paid back to us. I guess depending on the volume, and maybe a new auditor will have different thoughts on it, but as of right now, if you guys want to do the accounting, that's fine with me. As far as the revenue and all that kind of stuff, and then I don't know, I mean, normally on a quarterly or a semi-annual basis, I give you information so that you can then obviously, for the one we're discussing, you file that with the Department of Ag, but I mean, maybe the board asks for some other accounting as to, you know, what's the size of the loan pool. But I agree with Stella. I think the board is going to want this money back for cash flow at some point in time. And so I don't, you know, it could be on an annual basis or a semi-annual basis. I mean, once we get past the end of the year, that's for all you guys to worry about. So I just wanted to know. It looked to me like it went on forever, and I didn't see a need for that to happen.
Right. And I think, Stella and Denise, you know, in your expertise, should we be doing, is this an okay thing to go forward with? We had the county attorney look at it from a legal perspective. He didn't make any comment on the subject, of course, but are there other provisions we should include in this document? Do we need to have a few more days to put the correct terms in to satisfy the auditor and our budget director?
It's something we need to watch. Just in general, our county cash flow, it's strong. I will say that we are in a very good position. It's just that we are going to want to address how we are repaid.
Sounds like we need to put that. Go ahead, Matt.
And I would just add, to go back to Denise's question, I don't think ECIA has a problem with the accounting because, again, as I said earlier, we're going to have this streamlined. We're going to get ACH numbers up front. You know, they're getting this money ACH'd into their account, and our plan is after this 6 months, we're going to start, again, we have their ACH information, so that's how payments are going to be made back to us. So, again, it's probably going to be easier for us to handle that side and then issue the county a check whenever, again, if it's monthly, quarterly, you know, every 6 months, however you see fit.
I guess, in Matt, I agree on the accounting end of it. I think the board could possibly go approve these documents, and then maybe Stella and I offline can discuss, and Matt, when or how often we think we would want to get the revenue back, and when, if at the end of the calendar year there are funds, ECIA still has funds that haven't been loaned, if we want them back then, and we would bring a proposed amendments to these documents to you to clean those issues up, but get this going so that ECIA, you know, can keep working on it.
I guess my preference would be that everything be contained in one document. We just need to add some kind of budgetary paragraph with you and Stella writing that language so we can keep it in. I would prefer one document. We're going to have a major transition with a new auditor, and certainly we could draft something out to be ready to go on Monday.
I will just comment, this is Stella, that I intend to have the notice of public hearing for our agenda on Monday. We have to have our final budget approved in May. So that's intended to be on our traditional meetings, our traditional Monday meetings for the notice of public hearing and the public hearing. So I will need a decision on whether you intend to include the number in the budget. You don't have to execute these documents, but I do need to know that today.
I think there's consensus that we want to do this program. I think it's a matter of getting the paperwork completed so that we have, satisfied the due diligence requirement. And of course, Stella and Denise, your input's helpful and valuable at this point. So could we get these documents prepared for final signature on Monday? I think we have consensus, Chair Baker, to have, Stella put this into the budget amendment.
I would defer to Stella. We could, we could do it on Monday. We could do it today with a contingency, that be incorporated. So I think I'm defer to Stella for her timeliness issues.
I'm fine either way if you want to wait to execute documents till Monday, or if you want to do it today with contingencies. For me, as long as I know that that is intended to be in the budget, I will include it. It will be in our notice that gets published next week.
I think the best practice from my perspective, and Supervisor Wickham jump in too, would be to have a document that is complete and final. When you approve a resolution, when you sign the resolution, the underlying document, I think it's necessary.
Did we lose Ann? Ann, we lost you for a second there.
I think we can get it done for issuance of the agenda for noon tomorrow to finalize the documents.
Okay, Ann, Dave Baker, towards the end of your statement, we kind of lost your audio. Can you just maybe real quick summarize what you had stated, because we lost some of it?
Right. My point is that I think it's best practice to have a complete document. The resolution identifies the document, and that is clearly the best practice. So I'm making a motion that we table this matter until Monday's meeting to take it up at that time, anticipating we'll have a complete document.
Okay, is there a second? I will second that. I think that's reasonable that we have a complete document, but in discussion, it certainly sounds like we have consensus. So Stella, I think you can include it in your budget preparations, for your amendment, and then we'll act on the complete, clean document on Monday. Okay, any other discussion? All in favor of table?
Well, I have discussion.
All right, open for discussion.
Supervisor, here you said a few minutes ago about efficient and streamlined government, or fast, or something like that. So, we easily can talk ourselves out about anything. We have a trusted partner. We have a viable program that's been proven. The document, in my opinion, is complete. And you're just talking yourselves out, and what's going to happen is you're slowing down the business community. We're staring down 20% unemployment, if not higher. We've got hundreds of businesses that are shut down. We've got other community members that are helping these businesses. All the counties around us are doing grants, and we're on a loan, and you want to slow go it. I just think it's just not the type of responsiveness we need in a pandemic and an emergency.
Under discussion, in a pandemic and an emergency, there's great, I find, and it's personal belief, there's great purpose to being very mindful and intentional. We have consensus that this program will begin. It is a matter of getting a specific contract and that the details are ironed out.
I understand where you're coming from. I know you voted against the emergency declaration. You voted against the first round of funding for Board of Health at $400,000. You voted against the $200,000 funding for the Emergency Management Association. So I understand that fully.
Jay, the list is a lot longer than that.
All right, let's
Amen.
Focus on the motion, and we're in discussion, and I thought Ed Raber was trying to comment. So Ed, was I correct?
I was less not anxious to jump into your fray here, but I'd add that with the consensus, I understand all of the supervisor's comments, and in many ways they're all equally valid, quite honestly, at the same time. This has come up really quickly. if you have that sort of consensus, one of the things that is probably a next question is like, how will we promote this? And so I have not done that yet, but we will be looking to, with the different header at the top and some things, this is essentially the mirror of the revised Dubuque Initiatives program, just available to areas of the county that are outside the city of Dubuque. Over the next couple of days, we will prepare all of those materials and advise all of our partners, which includes the loan officers at our financial institutions, as I think Supervisor McDonough said, mayors, the city clerks or mayors around the county, as well as our partners at organizations like Greater Dubuque Development, the SBDC, and the Chamber and Economic Development Organization in Dyersville and in Cascade, if not wider. So some of those other things need to happen, and we also know that there have been inquiries by some businesses already to the Dubuque Initiatives program that were not eligible because they were in the county, and I think that connecting them later this week to this likely project that's going to go forward on Monday will be fine with me. So we can kind of do it both ways, I think. We'll prepare all those materials for partnerships so it's available on with our partners.
Yep. I'll just follow up on that. There's a team of Greater Dubuque Development, ECIA, NICC, Small Business Development, 15 people that have been working with local businesses. We are ready and able to announce this program as soon as the Board of Supervisors approve it. And we've been working with local communities. So waiting till Monday to get organized is not a necessity. The team to deliver and get services and additional resources to the local businesses is in place. Right now, the government body is the slowing mechanism and the reason we aren't getting this funding to small communities. City of Dubuque's already taken care of, but Epworth, Farley, Dyersville, continue on. They will wait because of the Board of Supervisors' decisions.
Any other discussion? Okay, all in favor of the motion to table till Monday, signify by saying aye.
Aye.
Aye. All opposed?
Nay.
Carried 2-1. We'll finalize it on Monday. All right, next up is item D, general assistance funding for burial expenses. I believe we have Josh Jasper is on the in the meeting, and I assume Stella Rundy is involved in the discussion as well. So turn it over to whichever one of you wants to speak on it. Josh Jasper, you can unmute yourself. I think Ann is trying to speak, but we're not hearing her. Nope. We're having some technical issues. Just bear with us. Yeah. Okay. I didn't. I'm gonna.
Welcome to Zoom. Enter your meeting ID. Enter your participant ID. You are in the meeting now. There are more than 30 participants in the meeting. You are muted. You can mute or unmute yourself by pressing star 6.
Thumbs up.
Okay.
Well, hold on. What's going on here?
We're coming back here. It sounds.
You can't hear the Board of Supervisors office. So Dave is essentially muted.
Okay, can you hear me now? No.
You are unmuted.
I would just.
Dave, try to
I
speak
know
now.
Nathan's working on
hear
it right
me?
now.
Yeah.
There you, welcome back.
All right. Obviously, I need to work on my sign language, so I might hang on to the brief recess sign, though. Okay.
There's value to that.
All right. Josh Jasper and Stella Rundy, our budget director, I'm going to turn it over to you for this discussion.
Sure. Is Josh unmuted? I'm sorry, I can't see.
There he is. He's unmuted.
Josh had asked me last week about the burial expenses. He provided the budget, I believe, that you all have, that he's getting close to expending all of those funds. And so he's inquiring about adding burial expense funding to the budget. So I just...
Stella, I don't have any documents. Nothing was provided in the package that I received.
We didn't get it in time for the packet, but then I had sent it out last night, and I believe it is on the website as well, the agenda website. And it looks like...
You sent it out last night?
I did.
Okay.
And then I believe it was just on the screen, and it's on our county website.
Okay, so this really hasn't gone out to the public then, right?
It's out on the website if people are accessing our packets from there.
It was sent to me at 8 o'clock last night.
So Josh, I'll turn it over to you to explain what's going on and what you're requesting.
Sure, thank you. As Stella mentioned, I just wanted to bring to Stella's attention where we're at with budget for burials. Wanted to get that to her before May 1st with amendments and just initiate a conversation with her and then potentially with the Board of Supervisors. On that document, you'll see where we're at right now, which actually has been adjusted. We just approved another burial this morning, and so the actual total remaining is roughly $2,700 in the fiscal year budget of that $79,838. And we received a phone call this morning from one of the local funeral homes letting us know that we have quite a few more potential burials pending based on what's going on right now. So I just wanted to bring that to the Board of Supervisors' attention. I know that we got the increase with the rent and utilities, but being mindful that this current budget will zero out before July 1st, specifically with burial needs.
How many burials have you done?
We've expended $61,000 in burials. 81% of the budget has been in burials.
Correct, but how many? What's the number?
Yeah,
And then we need
I don't have that in front of me, Supervisor.
So, right, I'd like to have you bring it to us with a breakout of how many applications there were, what types of burials there have been. We have, I think, categories of 3 different kinds. I would expect to see some change in the types of burials that are happening because we can't have, the full congregant service available, right, in today's COVID world. So, the breakdown that you've given us other times has been much more specific about burials in terms of types and requests. And I'd like to see dates on that to see if we have a trend and what the response of that is. My questions are how you're stepping this through for purposes of whether or not someone's eligible, and I'd like to see this year over year. 61,000 to date. What does that look like over last year, the year before that? Something like that I'm sure Stella can help you put that together.
Absolutely.
I think this is Supervisor Baker. I think that's good information for us to have. My question for Budget Director Rundy is so that we don't run out of funding, do we have a deadline because of your budget amendment, final budget amendment, that we need to act on. And then the second part of that would be, if we overshoot slightly, that money doesn't disappear, right? That can be carried over or reallocated. Is that correct?
Yeah, so there's a couple things going on. I will need numbers today if we're going to include anything in the budget. We never addressed any remaining fund balance at the end of our fiscal year, so that's something we should probably discuss at some point. I would assume that, because our contract with Resources Unite goes through June 30th, I believe. So any funding that they're holding at the end of June 30th, what happens to it? So we'll need to have a conversation about that. If we want it to carry over, how we want to address that. And also, we did transfer funding to Resources Unite for emergency COVID funding. We increased the rent and utilities. So there's a question of, you can reallocate that funding pot as necessary as well. So I think Josh holds that pretty strict. This much X amount was for rent, X amount was for utilities. He doesn't cross those buckets over. And so if you would like for him to do that, you would need to indicate that as well, instead of increasing the funding.
Those are good points, like how much is left in the rental account, utilities, what's left. I don't know that I can read that from the document that we have here. No, it's just a one page that's broken down by percentages.
We had transferred, and I believe, correct me if I'm wrong, but close to $80,000, about $79,000 initially when your contract was executed to do general assistance. And then just in the last couple of weeks, we have transferred another $100,000, which $50,000 was for rent and $25,000 for utilities, I believe.
But Josh, are you saying you only have $4,656 on hand?
Well, what I'm saying is, as of right now, with the FY20 budget, that $79,838, there's $2,706.63 remaining, which is in the categories of rent, utilities, and burial. And so we did receive, as Stella mentioned, that $75,000 in addition with rent and utilities, but I was just mindful of knowing that that was not marked for burial in that second installment, that in this current fiscal year, it will zero out before we're able to complete the burials over the course of the next month and a half.
Okay, well, I guess, what are you asking? What number do you anticipate you need for burials?
In the email I had shared with Stella, on the average, we spend just over $7,000 per month in burials. And so if we went simply by that from this past September, we could do that, where it would be approximately $15,000. But I'm open to, if the Board of Supervisors wanted to redefine that $75,000 COVID to include burial, that would work just fine as well.
I'm not inclined to do that, honestly. I think I would be more likely to put a dollar amount, again, for burials, but I wouldn't make it an allocation to you until we see the answers to my questions in terms of some kind of, report form. But for purposes of preparing the budget, I would allocate, maybe put just another $25,000 for purposes of burial. But I wouldn't support directing that to you until we see a more complete report. This brings another question, though, to me, which is whether we should be looking overall at needs, from the Community Foundation. Are there other anticipated needs from any of our small cities that have, with certainly, Josh, to your credit, the food pantries that you've been instrumental in opening? And when we look at freezing our balance, our budget amendment through apparently Monday, and anticipating what the next 7-8 weeks is going to bring, that's a difficult thing to do. Any help, Stella?
Sorry, I was muted. We do have in our budget that has not been expended. I had requested and we appropriated $750,000 kind of as a bucket to be able to be used. So
Okay.
in my mind, going forward, that is where we will be able to access funding if it's needed. That comes up in the next 8 weeks. But for the purposes of the amendment, I do have to have final numbers to get that published and meet the state deadline.
Have we used any of that $750,000?
I believe last I checked, we've used about $225,000 of it.
And that was for technology primarily?
Primarily, yes.
I have a question, Supervisor Baker, for Budget Director Rundy. If we have a surge or spike in deaths, and deaths that we would be responsible for providing the services under general relief or general assistance, burial services. If we were to have a spike and we didn't appropriate enough money, what would we do? What would be our options, if any?
Maybe Auditor Dolan can step in. There's provisions in the code for revising your budget under emergency situations. We're clearly in that, but Denise might have more detail.
I mean, I can just address in not emergency situations in the past, we have just stopped the funding and stopped paying for burials. I believe we did that last year or the year before, where we ran into the same situation toward the end of the year, the last couple months of the year. Last month or so, we didn't see any general assistance cases because we had run out of funding. I guess, yeah, if Denise is on the line, if she has any information on
in 33 years, this is the first time I'm aware of an emergency way to amend the budget to allow for spending over. So I need to look at the code section.
All right, I'm gonna ask Josh Jasper and Stella if there's a recommendation. What are you asking for? Is there a recommendation?
I would say that there's a couple of choices. You can indicate to Josh that you would be okay with reallocating the $75,000 that was transferred to him to include burials, not just rent and utilities. Or as Josh said, they spend about $7,000 a month in burials, so allocating another $15,000 to burials.
The numbers are likely to go up higher, though. We know we're going to have a surge in cases here, and I would like to be, I think it's going to be greater than what we've seen in the past. So that was my purpose in saying 25,000, but just don't know that the report's very complete.
And I'm happy to get those numbers to Stella, Supervisor McDonough, by the end of today for you.
I'm comfortable with 25,000, and I just want to make sure, Josh, Jasper, and Stella, that you're comfortable that that's enough to get us to the end of the fiscal year.
I would look to Josh to that information. I think we're in an unknown situation, and we have to just do our best to estimate what we can. And Josh, I don't know how you feel about the rent and utilities. If 75,000 could encompass burials as well. If you feel like that is possible, I would even suggest that route.
Yeah, I mean, we're definitely in an unknown situation. I mean, it's specifically for one of the vulnerable populations that we're working with in this category. You also have this coupled with religious beliefs that burial needs to take place. And so that removes two of the options from pretty much 100% of that population we're talking about. So that's a different budget. That's the 33 versus the 1950. cost. And so it's difficult for me to speculate as to how many people over the course of the next, like I said, I can give you the average of what it's been since September, but anecdotally, what I'm receiving from Hoffman Schneider Kitchen and other funeral homes, they're kind of giving us this, I suppose, status report to expect to get busier over the course of the next 30 days.
I think
Well, we could table it and wait till Monday.
Well,
I think we need to give
if you
Stella-
want to increase it, Stella needs to have an amount today. I believe there was discussion about possibly appropriating something and not cutting a check to the agency, but waiting until the numbers that have been requested come in, and then possibly also, waiting until we see that there's an actual need, have money appropriated, but not disperse the funds.
Well, we know based on how it's been running, we need to, if we're going to complete our obligation, we know we need an additional $15,000, and that's a conservative estimate.
Yeah,
and we would be expecting a year. Right. We're going to get a final report on a quarterly basis. I think, Josh, wouldn't we get a more complete report from you in June showing all of the numbers I'm asking about?
Yes, that's correct.
So, I mean, I guess for purposes of some discussion, I'm going to make a motion that we approve $25,000 to Resources Unite to increase the amount of money he's holding for burials.
Okay, there's a motion to allocate $25,000 to Resources Unite for burials. Is there a second? I will second it. Open for discussion. All in favor signify by saying aye.
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 Carried 3-0. Thank you.
Thank you.
Thank you, Josh.
Okay, moving to the next agenda item. Item E, resolution to approve the CDBG policies. I think we'll throw it over to Ed Raber.
Actually,
This is Ed Raber. And actually, I was going to say, I'm going to kick it over to Dawn.
Yep, so these are 6 policies that the board needs to approve in order for us to access the money for our non-for-profit partners who are doing expanded food delivery services. So I just want to make sure that we all have an understanding that these are not replacing any of our current ones. They're in addition to. Specifically, there's a procurement one, and this policy only applies to those funds. It's not our general county funds. It would be specifically to that $99,000. Supervisor McDonough had asked that we update the contacts to make it just more of a general contact person. So the ones that I am proposing for Chairperson Baker to sign have been updated, and you can see that on your screen. We just put the main county phone number and the Board of Supervisors chair. So if anybody has any questions, concerns, that will get funneled to the appropriate place, but they will contact here at the courthouse. They'll contact my staff. So I did update 3 of those to include the Board of Supervisors chairman as the contact person for the county.
Which ones did you leave without that, Dawn?
So the one you have in front of you is the Code of Conduct. I also updated the Fair Housing Policy and the Relocation Policy.
So all of those, then, all of the policies have been changed to read Dubuque County Board of Supervisors unless it's specific to the HR department?
That is correct.
Okay. My questions about this were whether these are these boilerplate policies that we're adopting? Is there opportunity for any of these to be crafted to reflect different priorities from Dubuque County, or are we just recommending that we issue the stock and standard language? I don't imagine any of these things have been reviewed by our county attorney, for instance. So, are we just doing this so that we have compliance in mind?
Correct. These were, yes, the only thing we changed was specific county information, but these were the boilerplate policies that we received from from the state.
And what happens if we don't adopt these?
I would imagine we would not be able to access those funds. We would not be able to show that we are compliant with the grant, and we would not be able to seek reimbursement.
Right. Would we have had to do this if ECIA continued to be the administrator of this grant?
I think
Yes,
yeah.
you would have to do that because you are actually the county is actually the applicant. It's not about who is administering it; it's about who the grant. Dubuque County is the grantee.
And the fact that we haven't had these in the past, Ed, and you, based on your experience, were you in any way surprised that we don't already have these policies, or are these things that counties don't normally do till they get to a community?
The second, supervisor, is that when you get a CDBG grant, you do this. And in fact, if you happen to be a community, a small community that routinely is able to access federal CDBG dollars, every time you do it, every time you get one of those, you reaffirm these just as Dawn has presented them to you. So you also are not the first elected official that looks at them and says, what are we doing this for? But that is the cost to participate. This is what not just at the state. This is probably across the country. That's the way that HUD asks that you, at least as it relates to their funds that they're entrusting to you through the state of Iowa, that this is how they would like them to be guided.
We're looking for a motion on the resolution, and there's the resolution that would apply to the 6 different tree killing policies.
I think some of them could be purposeful in guiding some of the discussions we've already had done about EEOC matters, and there's things I know you're working on that are related. Some of these policies are, yes, they're boilerplate, but they also contain some things we might want to use as starting grounds for some discussions that we could have at the county level.
I agree.
So I'll make a motion to approve the resolution.
Okay, there's a motion to approve the resolution. Is there a second? I will second it. Open for discussion. All in favor signify by saying aye. Aye.
Aye.
Aye.
Carried 3-0. All right. That's the extent of the agenda for today. I do want to talk about next meeting would be next Monday would be our regular board meeting on Monday, May 11th. I would assume that we would start with 8:15.
I believe 8:30 is what.
8:30 work session with Anthony Bargett, our county engineer. 9 o'clock would be the regular meeting, and then would we shoot for 10 o'clock?
10 o'clock for our joint meeting with the
10
Board of
o'clock
Health.
for our COVID 19 County Emergency Response Team meeting at 10. And then I assume we have some work sessions after that. I do want to point out, and this is at the request of Jenny Hillary, our elections commissioner, that the Board of Supervisor chambers, and this really doesn't affect anyone but at this point, but Dawn and myself, but the elections folks are going to need the Board of Supervisors chambers on Monday, June 1 and Tuesday, June 2 to count absentee ballots. It should not be an issue. I don't think we need to change our meeting schedules unless we have already done that, modified our schedule during this pandemic. But I would think that we would be okay, and I can certainly make myself available in another room and sign documents and whatever. So, but for now, for next meeting would be a regularly scheduled meeting on May 11th. So I think a motion to adjourn is in order.
Could I ask, while we're talking about meetings, are we also thinking the pattern will continue for Wednesday? The Wednesday meeting would be at 10 a.m. I think that we have an RTA meeting that they've posted for 9:30. And
they
just
might have
asking if
changed
that's a
that.
pattern.
I think they suggested a 9 o'clock, and I didn't really get into it. I think it came in this morning.
I suggested that.
Okay.
So it's
Well,
come
thank
today,
you.
maybe? All right.
Thank you for that.
I'll make a motion to recess until Monday at 8:30.
Okay, it's actually adjournment in this case.
Adjourn.
Okay, motion to adjourn. Is there a second?
I will second that.
Okay, all right. All in favor signify by saying aye.
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 Meeting adjourned.